it slow. Today, I thought I would tell you and show you about getting dressed as a frontliner. I work in a hospital as a respiratory therapist. And this is how I get ready. So first off, you want to pick out a long sleeve if you're cold like I am. Crappy shirt. Because the chances of it getting foreign fluids on it is pretty high. So pick out something that's comfortable and will keep you warm, but you don't really care anything about. So that's where you start. Jewelry. I don't need these. They'll just get oxygen nipple. It attaches to the oxygen flow meter and is what allows us to hook up the tubing. It's very important, and a lot of times hard to find one. I don't know why that is, but so I like to keep one on my person just in case. So then chapstick. I don't think I need to explain that one. So then scissors. I have 2 pairs. I only bring one at a time. Truthfully, I thought I lost this one, so I got a new one, and then I found this one. There have been many times where you need scissors. You need something as simple as opening up a package. There's a lot of disposable items that you have to open up. So, opening up the packages or cutting tubing, or if you're in the ER, cutting clothing in a trauma situation. So, I pick one, and then I bring one with me. Pens. So, I need a dry erase marker for the boards in the rooms to put your name down or goals for that person. I need a Sharpie marker to date the items. So that people know when to change different equipment out. So that goes in that pocket. And then I have different color pens. And this is really just for my own color coding method that I have for the sheets. Everyone has their own method of arranging their assignment for the day. One of my really good friends used to bring in like 6 different colors, and every little thing was differently laid out and colored. And then I have another friend who this pen is the only one she would use, and it had to be this pen. It couldn't be, this in black. It had to be this pen. We all have our quirks. So some pens. And then there are times where you're doing different tasks that may require you to erase. So, like building an assignment for the next day's shift. Sometimes it's digital, sometimes you gotta handwrite it and then erase a lot. So, and then a highlighter for me. This is also part of my method of locator. Different hospitals use different things. I've used a pager. I've used an old, almost Nokia phone. I've had an iPhone, and then I have a locator. So it just depends on where you work, which you'll have something so that people can find where you are and get in touch with you. So this can clip in, but I just put it in my pocket. Again, that's why I like having so many. And then this little guy. So this is really important. This is a pulse oximeter. So you put your finger in here. See, apparently I'm dead. And it's going to tell me what my heart rate is. And it's also going to tell me what my oxygen saturation in my blood is. So my heart rate right now is 91. And my saturation in my blood is 98, which is great. So I also have this here because there are parts of the hospital that they're not hooked up to monitors and we have to check this. So here comes the really fun part. I'm gonna lotion up one more time. Also, I do carry a stethoscope around my neck, but I left that at work in my locker. And that thing is absolutely vital. As a respiratory therapist, but as a nurse as well, you need to be able to hear what people are doing. Okay, nice and sticky now. So, what you look like outside of work. It's actually a very kind of fun game. Guess what other people look like, because nobody really knows what I look like, and then I have no idea what any of my coworkers look like outside of the hospital. So, yeah. Hello. Welcome. Come on in. Yeah. So I'm Morgan. I'm going to be your respiratory therapist today, okay? I heard you're having a little trouble with the breathing. Yeah. Okay. Any history that you know of? Mm-hmm. Okay. Okay, so not too bad. Okay. I have your chart here. I'll kind of go over it a little bit with you. But I do need to do some tests, okay? So I know they already did a chest x-ray. I'll be getting those results pretty soon, okay? But I do need to draw a little bit of blood. And we'll do some medication and a nebulizer. And I've got some pulmonary exercises for you to do as well, okay? I'm waiting on the lab for the sputum sample that you already sent down. I know it's kind of gross. It feels gross to spit in a cup, I know, but it's okay. It just helps us kind of narrow down what we're really dealing with. Mm-hmm. Okay. So first thing, I'm going to come around the table and I'm going to listen to your breathing, okay? I'll go on the back a couple times, deep inhalations, okay? Okay. Okay. Deep breath in. Good. Good. One more. Excellent. Okay. I am hearing a little bit, just a little bit of congestion in there. So we'll try to, I've got an exercise specifically that will help you bring up those secretions, okay? All right, let's go ahead and do the COVID test. Just get that out of the way. This is a little bit unpleasant. I'm sorry, but, I had to get it done. And it does feel a little bit like it's all the way up in your brain.
Obviously, it's very long. So, can you lean forward? Perfect. Okay. I know. Okay. You alright? You okay? Okay. Okay. Is that bad? No? Okay. Stick that in there and I'll send that down to lab. Okay. So this is the blood that I gotta draw, right? I'm not gonna lie to you, this hurts a little bit. You've got veins and then you have arteries in your system, in your body. And veins are the ones that IVs go into, but arteries, that's your oxygenated blood. Veins is your deoxygenated blood. So they are different. A lot of times we'll have people come in and they think they have, because they have an IV, I can just pull blood from there, but unfortunately, that's not how that works. Because trust me, I would much, much, much prefer to just draw from the IV that's already existing, and I know most patients would feel that way too. So I see you got that peripheral IV, but unfortunately, I gotta stick you again. I'm sorry. See, they've just giving you fluids. That will help with the hydration and thinning of your secretions. Okay. Did they tell you what the last blood pressure was? Okay. Is that normal for you? Okay. Alright. So, I'm going to move my things a little bit here. If you can just put your arm up here. Good. Thank you. Move my things. So I'm going to just feel around for a little bit, okay? I'm just checking to see if I can feel a good pulse. Because again, that's what I need to be looking for, is the pulse. That determines whether it's an artery. Okay. Alright. Perfect. So, get my stuff. This is just alcohol, okay? It's a little cold, isn't it? Excellent. A little bit of gauze, and of course your Band-Aid afterwards. Sorry, it's not, a fun color. Okay. Okay. I'm sorry. I know this is not going to be the most fun thing in the world, okay? Let me just get my Band-Aid back close. Okay, you ready? Feel around. I'll give you a countdown, okay? Nice deep breaths is all I want you to focus on. 1, 2, 3. I'm sorry, I know that hurts. You're doing great. You're almost done. Almost done. Good. Okay. Excellent job. Excellent job. Okay. So I'm just going to get rid of this cap. That wasn't too bad, was it? Okay. I know it's a little rough, but we got that. So I'm going to send both your swab and your ABG, arterial blood gas, down. Okay. All right. Be right back, okay? Just putting them out here. So, since you've been having trouble breathing, I'm gonna have you do a nebulizer treatment, okay? This is a bronchodilator. It's called albuterol. Typically, most commonly I should say, we use it for patients with COPD and asthma. Since you've been having trouble breathing, it's going to just relax your airways, open them up a little bit, and make it easier for you to breathe. Okay. So, I've got a nebulizer here. You said you never used one before, but it's really simple. I'm going to take this. So this just goes right in here. Close it up. And then you're going to put your mouth over this. I'm going to turn it on. And you're going to breathe in and out fairly normally. If you want to do a little breath hold at the end of every inhalation, that will make it work even better, okay? Alright, let me show you how it goes. So you can see the mist coming out. Okay, you take that. And nice, easy breaths. Good. Excellent. Good job. So, I'm just going to kind of look over some of your valves, okay? While you're breathing in that. So, I did get your chest x-ray back. Okay. Yeah, I think most likely you probably have pneumonia. But that's a fairly easy treatment. Okay, I am going to give you a couple exercises to do, pulmonary exercises to do as well, okay? So as soon as you get like that, we'll move on to that. Keep breathing. Doing great. Okay. Do you have any allergies that you know of to any medications? No? Okay. That makes that easy. And in terms of history, it's just the asthma, correct? Okay. But no respiratory issues previously? Okay, that's great. Okay. That sounded like that's almost done. You can just turn the button off right there. Yep, just like that. Good. Alright. I'll put that here. Okay, so just a few more things that I'll have you do, and then I'll get you out of here. So, you said that you were having trouble with getting the secretions up. Hydration is going to be very important for that. But we call this a flutter valve. It has several different names, but flutter valve is my favorite, and you'll see why once you blow into it. But I'm going to hand this to you. You're going to blow hard into it like you're blowing up a balloon, okay? Just like you're blowing up into a balloon 10 times, okay? Any questions? Okay. There you are. So just put it in your mouth and then blow into it. Okay. Oh, your lungs sound great though. Do it 3 more times. 2 more. Well, I can definitely tell your lung capacity is very, very good. But so that's just going to help. Basically, all it does, that one, is it shakes your lungs. Okay, so any secretions that are really tenacious and really stuck on your lungs, it creates a back pressure and shakes them. So it loosens them up, pulls them to the center, and then you can cough them up yourself. Okay, that's the idea. Again, hydration to make sure those are thin is going to help too. So this device you may have seen these before. Okay, so this is an incentive spirometry, IS is what we call it. So I'm not going to give you a goal on this side. You see, okay? We can move this up and down, but really that's not as important to me as this side right here. So you're going to take a slow inhalation on this, a long, slow inhalation. The idea is you're trying to get this to rise in between these arrows for as long as you can. It's very different than going, very different. You're going, okay, does that make sense? And we can adapt this based on how you do, but I want to see this inside of the arrows for as long as you can, okay? I'm going to hand it to you. Take about 5 deep inhalations on that, and then we'll go from there. Good. That was fantastic. I'm very impressed. It takes a while for it to go back down as you're seeing right now. Go ahead. Okay, absolutely wonderful. Let me adjust the here. See, it kind of takes a while to go back down. So we're gonna, based on those first 2, we're gonna have you go all the way up here, which is excellent. Okay, so we're gonna do 2 more deep breaths on that. And of course, I will give you these to take home with you. Okay, good. I know it takes a little bit. Good. Excellent. Okay, so I'll package these up and you'll be able to take these home with you. Okay, these are pulmonary exercises that I want you to do. All right, and I'll give you a script for the medication as well. Okay. All right, your chest x-ray came back. So yeah, it definitely does look a little bit like pneumonia, okay? So I've got some infiltrates. That's definitely where you're getting those congestion from. Okay. So I'll send you home with the flutter valve and the IS, okay? And I want you to make sure you're doing those. Especially if, right now there's not a whole lot of exercising and gyms going on, okay? So it's really important more than ever that you're exercising your lungs as well. When we have a more sedentary lifestyle, then you can lose some of your lung volume, your alveoli. They can collapse on each other because they're not being used. And so we want to make sure we're taking deep breaths. We want to make sure that we're, up and moving as much as you can. So those exercises that I went over with you is going to help, okay? That IS especially is going to help pop open those alveoli. And then the flutter valve is going to help move those secretions so you can cough them up, okay? And then I'll send you home with a script of albuterol. You want to see your chest x-ray? So I kind of marked it up, but there's definitely some, congestion. And that's okay, we'll get that up. So I'll send you home with a script for albuterol. So I showed you, it's in these unit doses, okay? So you'll just rip open the package and put it in the nebulizer send you home with, okay? And this is 1 dose, all right? Just like a pill, this is 1 pill, so you're only going to use 1 of these at a time. Make sure you're reading, all the side effects. There can be headaches. I get headaches really bad when I take it. headaches and, dizziness. To me, when I take it, which thankfully hasn't been too often, but it can feel almost like you take Benadryl. If you get kind of like, ooh, that's how I end up feeling. So some dizziness, some lightheadedness, potentially. But you took it here and you were just fine, so I wouldn't expect you to, but it can happen. Make sure you're just reading all the facts, okay, that the pharmacist sends you home with, alright? And you're only going to be taking those QID, so 4 times a day, okay? So no more than 4 times a day, alright? And that's if you need it, alright? This is going to be PRN, so this is only if you feel like you're having trouble breathing, okay? Alright, so we'll do a couple doses of those. Okay. That I'll have to give to them. And then let me just check. Okay. Alright. Okay. Yeah, so it does look like the sputum came back. So I do believe you have pneumonia. I'm going to write you a script for levofloxacin, okay? 500 milligrams. You're going to take it daily, just 1 pill daily, up until 10 days. This is an antibiotic, so I'm sure you know by now you have to take the whole course. Okay, don't stop 5 days in just because you're starting to feel better. Okay, make sure if you need to set an alarm, I do that. I set an alarm on my phone for that specific things that I'm not used to doing. If I have to remember, just pick a time, set an alarm, make sure you do it for 10 days, okay? Alright, so we'll do that. I'll send you home with albuterol, those pulmonary exercises. Okay. And I'm just going to check on that rapid test just to make sure that it's not something more, but everything's coming back exactly like pneumonia, okay? So let me look at that in your ABG. Oh yeah, okay. Your ABG looks great. Alright, your pH is normal. Your oxygen, because that's what we're measuring when we look at those ABGs, is the gases in your arterial blood system. The gases meaning the oxygen and carbon monoxide, dioxide. So we're making sure that your CO2 is not too high, making sure that your oxygen is within those normal limits. Everything looks good. So CO2, oxygen, fine, bicarb, fine, everything, which is great. And then your last thing is the COVID test, so let's just check that. Did you notice a difference with the medication I gave you? Yeah. Yeah, I think it's great. I've had people just come in and they've taken one of those and they're like, oh my gosh, I wish I could have this every day. Because it does, it really just relaxes those muscles and it makes you feel like you're breathing for the first time. Some people have said that. Yeah. Yeah, we just need to get those secretions, pulled out. Because your lungs actually sound like you have really good volume and you proved that on your IS that you did. I mean, we get a lot of patients that are, here and you just went nearly to the top. So you're not worried about your lung volume as much. We just gotta get those secretions up, staying hydrated. I'll give you the albuterol on the script for the antibiotic, okay? Okay, and let me just double check the COVID test. It hasn't quite gotten in. Looks like they're running it right now. So just another second or two and we'll get that in there. But you haven't been around anybody with COVID or anything like that. That's what your chart says, so I don't believe it's that. And everything else presents like pneumonia. No, all in all, you're very healthy. So I'm glad you came in to get the help that you needed to. But okay, yeah, you're all set. It's clear. Negative for COVID, okay? Do you need a printout to take back home with you for work? Negative COVID test? Okay. I'll have that. Print it out over. Okay. So you can just take your x-ray and you can go up to the checkout, okay? They'll have the script for you and everything else, alright? And you just take it to your whatever pharmacy you use and pick it up. Give them about an hour or so to get it filled. And then you can come pick it up. And I hope you feel so much better soon. I'm glad it wasn't anything, too serious. Just make sure you take the antibiotics and you've got all the tools that you need at home now, okay? Okay. I'm sorry you're sick, but thank you for coming in.
Hello, Dr. Mo. It's so nice to meet you. So I'm going to be your anesthesiologist, okay? So I'm going to be in charge of your breathing and putting you to sleep, and I'll be here monitoring your respiration the whole way through, okay? I do have just a few questions for you. I know you've answered these for the surgeon already, but so is this your first surgery you've ever had, or have you had other surgeries? Okay. Okay. Are you allergic to any medications that you know of? No? Okay. Do you have any concerns with this? Any questions about the actual surgery? It's gonna be okay. Oh, honey, I can tell you're scared. You're gonna do so great, okay? The surgeon we have is one of the absolute best. Yeah. And here I told you about, the aftermath, what to look for. Okay, soreness is gonna be completely normal. Yeah. You're afraid of the pain? Okay. That's understandable. We're going to be monitoring your pain throughout the whole thing, okay? Your heart rate can jump up if you're in pain. Your respirations get different. Your respiratory rate, volume of respirations, everything will change, and we'll be monitoring that, okay? No, you won't feel a thing during the surgery. I know there are some pretty scary stories out there, but if you said you haven't had any history of surgery, so the sedation that we're going to give you, you shouldn't have a tolerance for, okay? You're going to do so great, I promise. No, you're okay. I'll talk you through every step of the way, okay, until you're knocked out. Yeah. Okay. I'm gonna go get washed up and get ready. You just sit here, focus on your breathing right now. It's a really good way to relieve some stress. Just in and out. Nice and easy, okay? Close your eyes. I know you're nervous, but you're gonna do great, okay? I'll be right back and I'll talk you through everything. Okay, be right back. Yeah, the scan is
just to protect you. How are you feeling? Any better? Still a little nervous, huh? You're gonna do great. Okay. Okay. Let me walk you through some of the things that we're gonna do, okay? So first off, this little guy is pulse oximeter, and it is going to be on your finger, and we'll plug it in and attach it to our monitor, okay? And it's going to monitor your heart rate and your oxygen saturation, right? And your oxygen saturation just means that how much of your blood cells are saturated with oxygen, okay? How much is getting to your tissues, to your lungs, to your brain, okay? So we're going to be monitoring that. If we need to put on oxygen on you, we can. No problem there. I've got it all set up as you can see. Yep, that tube. Yep, we'll just put it in your nose, nasal cannula. That's it, just for a little bit of extra help if you need it. Okay, hopefully we won't need to even go there. You're young and relatively healthy, so it shouldn't be a problem. Okay, so I'm going to use this alcohol. I'm just going to wipe it off. Okay, so you'll just put your finger right in here, right there, like that, and I'll clamp down. It doesn't hurt. I promise it doesn't hurt. Okay, here we go. Yeah, just on your hand like that. Good. Good, and I'll plug it in. See, it's reading up there. Yep, 79 heart rate, 98% saturation. Those are really good numbers, okay? Those are great numbers. Okay, so that's that. I need to test your IV. So I'm just going to test your IV, okay, just to make sure that it works. Give me your hand. There you go. Okay, good. It's got good flush, pull back, everything's good, okay? So that should not be any problem whatsoever. Okay. Let me show you the mask, alright? So this is what I'm going to be using to administer your sedation today. Okay, we test your IV for other, you're going to be getting saline. And if we need to give other medications like pain, that's definitely something we're going to be giving you is pain medications. We'll do that. Okay, if this doesn't work, I know this is your first choice. I totally understand. If for whatever reason this isn't working for sedation, we will move to IV. Okay? Oh, you're gonna do great, honey. You're gonna do so great. But so this we'll have connected right here to the gas, and I will be monitoring that. Okay, that's my job. The surgeons are going to be worrying about other things. I am only going to be focused on your level of sedation, your heart rate, your breathing, okay, your pain. Those are the only things that I'm going to be focused on. I promise you're in great hands. I know any surgery is really scary, but your surgery is a pretty common one, okay? It's something I've done a million times. We did one this morning already. Yeah. So, yeah, that's right. We do them pretty much, 3 days a week, all, 12 hours that day. Alright, it should only be a couple hours. You'll be in and out in no time. There's going to be some soreness, like I said, and it's going to be important that you take the medications that the surgeon will send you home with, okay? Just some general antibiotics, just to make sure, no infections happen. Anytime you cut into somebody, there can be some infections. Just like anything. Anytime there's a wound. Yeah. But you said there's no drug allergies, so okay, that's perfect. Sometimes a lot of people are allergic to penicillin, so. But anyway, so we'll put this right on you. You will breathe it in. I'll have you count backwards, okay? And if you get down from 10 to 1 and you're still not asleep, we'll start doing the alphabet, okay? But normally people are out before they can get to 3. Yeah. Yep. And I will be monitoring you the whole time. Okay, so that's going to be how we administer that. I do need to just set up a couple things real quickly, a couple cords, okay? So I just want you to lay back, take some deep breaths. I'm just going to be fiddling around with these cords in front of me, okay? For a little bit. Okay. No, honey, you're gonna do so great, I promise. Yeah, hold on. Give me your hands, yeah. I would not lie to you, okay? I know this is very scary, but this is gonna be a really good, easy surgery for you, okay? I know, you're scared. We answered all your questions, right? Is there anything else that's bugging you? Any other questions you need to be? No. Okay. Well, it's gonna be alright, okay? I will wait for you to wake up, okay? I will be at your bedside. I don't normally do this, but this is my last surgery of the day. And I'll just wait till you wake up, alright? I'll be there. You said you do have some anxiety. What do you take at home for anxiety? Okay. Did they give you any of that today? Actually, I can ask the surgeon when it comes. He's saying no. Okay. All right. Well, how about we give you something to help you ease up a little bit. Okay. So we'll just give you a little bit. All right. Just to help you kind of relax. Ease into this. You're gonna be out, I promise. But right now your heart rate's a little bit, higher than it was before. So I just want to make sure you're okay. Still, everything's normal. You're within the normal range. I just can tell you're really anxious about this, and I'd rather you just have a really good experience. Okay, let me see your IV again. 2 milligrams. Okay. 1. It's a slow push. Okay, that way you feel a little bit. Yeah, it tingles when it goes in, so that's a slow push. That's 1 milligram. You ready for the second one? And 2. Okay. I know it tingles, but it's gonna kick in real soon. Yep. It's a real quick one. So I'm just gonna kind of prepare some things in front of me. Like I said, I want you to just relax as much as you can. Close your eyes. It's okay. Close your eyes. Think of nice, pleasant things. Good. Your heart is already coming back down. Good. Nice and slow breaths. Good. You got this. You got this. Don't worry. It's okay. It's okay. It's okay. Good. In, out. Good. Doing great. It's kicking in a little bit. Excellent. I'm glad to hear that. Okay, we just have a couple more minutes before he comes in. So I'm just going to kind of get some things ready. You focus on that breathing. I'll keep talking to you, okay? In, out. In, out. In, out. In, out. In, good. Out. In, out. In, out. In, out. Getting a couple things prepared for the doctor. In, out. In, out. In, out. In, out, in, out, out. Okay. How you feeling? Doctor, I've got your gloves. Alright. Are you ready? Okay. Okay, sweetie, how are you? Are you ready? Yeah. Like I said, you're just going to focus on your breathing the whole time. You're going to be put out in the moment. Yeah, and you see the monitor. You see that we're watching you. Okay, and like I said, the oxygen's right here. We got the monitor and the oxygen, okay? And if you need some, I can give you some. We have everything ready if we need to intubate, which we won't have to do. But if we do, we have it all prepared. We've done this a million times. I will be there when you wake up, okay? I promise. Okay, here we go. Okay, honey, you ready? So, now I need you to count back from 10. 10, 9, good, 8, 7, 6, 5, 4. Hi there, sleepyhead. Hello. Welcome back. How are you feeling? A little groggy, I can see. It's gonna wear off real soon. It went very well. Very, very well. Okay. Everything went exactly like we wanted it to. You are going to get back to a life that you deserve. Pain-free, other than, of course, a little bit of soreness from surgery. Yeah. Yeah. Nothing to worry about moving forward, okay? I know this was really scary for you, but you did so well. So well. Yeah. So they're just going to give you one more round of fluids. We've got some antibiotics that you can pick up on your at whatever pharmacy we got in the system for you. And you'll be on your way. Okay? I'm going to give you a couple alcohol pads. Just because sometimes when they remove the IV and the tape, it can cause a little bit of sticky residue. And I don't know why, but that's one thing that me as a patient, I hate that. So this is just going to help remove that sticky little tape residue, okay? Just rip it open, smear it, all gone. Okay? And we are going to keep the pulse ox on you for just another minute or two, just to monitor everything. Everything went well. You did not have to have any oxygen. Did you notice anything at all during surgery? No, I told you we were going to put you out. And no, we did not have to move to any IV medication for sedation, okay? The mask, the gas worked perfectly, just like I anticipated. Are you excited? Not yet? I'm too sore to be excited right now, huh? That's understandable. So we're just, I know this room looks different. You're no longer in surgery. You are going to be in rehab just for about an hour or two, just so we can watch you. Okay, I told you I was going to be here when you got up, so I wanted to make sure I was. You've got wonderful nurses here. wonderful nurses that are going to monitor you and take care of you for the next 2 hours, okay? And then you should be able to go home. Make sure you take those antibiotics, and we'll give you a script for some pain meds because you are going to be sore for a couple of days, okay? The trick about pain meds is you don't want to wait until it's a 10 on the scale to take it, okay? You also don't want to take it when it's a 1. And 1 means you're doing okay. I know some people like to play the tough person role where they wait till it's unbearable, but the thing about pain is it can cause your stress hormones, cortisol, to skyrocket, and that causes a cascade of other things that we really don't want to have happen right now when you're in this vulnerable state. So I know pain meds is kind of a controversy out there, controversial topic, but we don't want you to wait till it's a 10 to take meds, okay? Somewhere in the middle. Yeah, 4 to 7. That's when you want you to take meds, because 1, it does take some time to kick in. 2, we do not want that skyrocket of cortisone to kick in, okay? Okay, all right. Well, it was so nice to meet you. We got through it okay, like I knew you would. I hope you have a wonderful time enjoying your new fixed body. Thank you so much. Come in, have a seat. Sorry, my hands are so cold. I've been in this office all day and it's just freezing. But I'm Dr. Mel. Nice to meet you. Alright, have a seat like I said, and I'm just going to go over some things, ask you some questions. This is your first time in a cardiologist's office, correct? Okay. Any allergies that you know of? No? Okay. Can you tell me your medical history? Anything I need to be aware of? Pre-diabetic? Okay. Any history of, I'm sorry? Okay. Alright. Anything else? Previous surgeries? How long ago was that? Any complications I need to know about? Okay. Alright. What about family history? Any heart attacks? Stroke? Dementia? Diabetes? Anything like that? Okay, well that's good. That's really good. No sudden deaths before age of 60? I guess that would have been sudden. I'm sorry to hear that. Oh, really? Wow. Wow. Okay. Well, what about medications? Are you on any medications currently? Okay. Alright, well your blood pressure looks pretty good. We will do an EKG and we'll kind of go over some information with you. Let's see, any history of drinking and smoking? Either one of those? No smoking? What about alcohol? Occasionally, like once or twice a week, once a day, once a month? Okay. Okay. Alright. Okay, and then in terms of any physical symptoms that you've been experiencing lately, shortness of breath, dizziness, can I see your legs? Any leg swelling? I'm gonna just kind of squeeze them a little bit just to make sure, okay? Okay. Doesn't seem to be any edema, which is a good sign. Okay. Chest pain, tingling? No. None of that. Can you tell me a little bit about your lifestyle? How often are you exercising? Okay, and that means, do you go to the gym and run? Do you lift weights or bike riding? Okay. Okay, that's excellent. Okay, definitely we're gonna want to keep that up. Okay, that's wonderful. And then tell me about your diet. Okay, yeah, so there's some room for improvement. Obviously, you saying you're pre-diabetic, that's probably has something to do with it. Yeah. Okay. So we may want to take a look at your diet and try to get you on a healthier pattern. Yeah, okay. We've got something called the DASH diet that I can go over with you later. There's a pamphlet I'll give you and all that. These days there seems to be a lot of alternative like meal planning kits and things like that. Might not be a terrible idea, especially with a busy lifestyle. I know, it's hard, isn't it? It's so much easier just to go through a drive-through and pick something up because you're just tired and you got too many things on your plate. I understand, but it definitely doesn't make an impact, okay? Yeah. And speaking of stress, how is your stress level? Yeah, I know it's been a hard year for everybody, but we're not talking about everybody else, we're talking about you. It's okay. Yeah, it's okay to... You know, sometimes saying no is the best thing. And it doesn't mean that you're being selfish. It means that you are taking your own life and your own care into your own hands. You don't have to do it all. You don't have to do it all by yourself. You can delegate, you can ask for help, and you can just say no to things. And that's okay. You don't have to even give an explanation if you don't want to. But if you do, just saying I'm doing it for my health, people tend to take that pretty well. No, I'm sorry, I can't do that, Susie. I gotta take care of my health. No, I mean, nothing has to be wrong with you to take care of your health, right? I know that's the next question people ask. Oh, why do you have to take care of your health? What's wrong? Nothing's wrong. I'm doing this to prevent anything. Because the best cure is prevention. I know it's a sappy line, but it's true. Okay, so yeah, just say no to things. People will understand, and if they don't understand, then maybe it's okay too. Okay, so, alright, so we'll talk about the diabetes thing. The great thing about diabetes is it's in your control in a lot of ways. With type 2, like, you can change that around. It's in your power. So we'll just talk about some diet. Obviously the exercising is going pretty well, but we can talk about that. And with your stress levels, say no. Have you ever tried to meditate? Yeah, I hear ya. It's a hard one for me to get into too, but there's an app called Headspace. There's a couple Calm, all these different ones. YouTube isn't a fantastic tool. Yep. Yeah, so you've got some things. Your hope is also an excellent. You've tried it. Yeah, I know. Then it feels like you're just adding another thing to your list. But if you can, it is a good one. Mind, body, spirit. I get it. Okay, so. Alright, and we already drew labs, so we'll wait and we probably won't get those results at this visit, definitely not, but we'll get them to you and we'll go over them. I do want to do an EKG on you, just to see kind of where we're at, alright? Yeah, that's why I got you in the... That's okay. Yep, okay. So I'm going to put these electrodes on you. Okay. And then we'll hook it up. Okay. So, I'm going to just be looking here. Good. Okay, I want you to take a deep breath in and out. In and out. In and out. Okay. Alright, so that's gonna print, and I'll look over that, okay, as well. But, sure, I can go over that with you real quick. Let's see. Not a problem. It can kind of look like squiggles, but really this is the one you want to look at, the top one, okay? This is your normal sinus rhythm, okay? So this is what we want your heart, your EKG to look at. Okay, these are all a little bit more scary down here, and that's okay. We won't worry about those. We're just hoping that yours looks just like this. No ST elevations, nothing. Okay, no heart blocks. That's what we're going for. Yep. Well, you said it didn't run in your family, so that's a good sign. And like I said, really the only thing I'm worried about based on your history and my quick medical exam is really just, the diabetic. Pre-diabetes. Yep. So the EKG is printing. I do want to take a listen and see if I can't hear any murmurs or anything, okay? I'm not hearing anything that is a cause for concern, which is excellent. Okay. So I'm gonna be right back. I'm gonna go check it out of the printer. Alright? Be right back. Okay, so it looks pretty good. Nothing really that's concerning. Not terribly surprising. But we just want to get the diet under control a little bit better so that this continues to be good checkups. Okay, well, I'm going to give you a pamphlet on it. Basically, you want to limit your sodium, eliminate your fats, your sugar. How many sodas do you drink a day? Okay. So that's my number one thing that I try to get anybody off of is liquid sugar. I mean, processed sugar is not good for you around the block, but we gotta have a little bit of fun, or else what's the point, right? But if you can get off your sodas, your sweet teas, anything that is lemonade has a lot of sugar in it, Kool-Aid, juice has a surprising amount of sugar in it. So if we can just start with that step first, do that for a few weeks, wean yourself off of all the liquid sugar, I think you're going to find it's going to make a big difference. Yep. Yeah, stick to coffee with no sugar added or very, very little creamer. Tea, not the sweet tea, the real tea, tea bag, hot water, a little bit of lemon if you want it, a little bit of honey. Water, water, water. Yep. And if you do have a little bit of something sweet like cake or anything, have a glass of water with it. That will help that insulin spike. And then go for a walk. That will help that insulin spike too. Yep, those are all ways we can kind of cheat a little bit. But I really want you, because you're pre-diabetic, you're not in there yet, but if you take out that liquid sugar, I think you will find the next checkup that you have, things might be very different. We don't want to put you on medication, we just want you to change a couple things, okay? Monitor your sugar. Yep. Yep. And another thing we've been getting some success with is fasting. This is little, what's the word, controversial, but when you fast, you're not having that same insulin resistance because your body's not having that insulin spikes. So you could try that. Not everybody's cut out for fasting. Yeah, I would just start with, 12 to 14 hours. Just do it once a week. Cut out those liquid sugars, try fasting once a week, see how it goes. Yep. Because we're just trying to get your body to not be insulin resistant. Yep. Okay. Okay. Yeah, everything else looked pretty good. I don't think we have it. Do you have any questions for me? No, we don't want to put you on medications. We're not there yet. We are hopefully not ever. Yeah, we're going to fix this diet situation and then we are going to be good as gold. Okay. Yeah. Yeah, say no to people. It's fine. Stress, diet, exercise. Yep. You don't have any family history, so the good news is a lot of this is in your hands, in your control. Yeah, but you exercise. So sitting all day at the office isn't that bad because you exercise. Get up and try to walk around. Just try. I know it's hard. You get sucked into, whatever you're doing at work, but I know. You look up and it's 3 hours later. But try. Maybe set an alarm on your phone that's quiet enough not to disturb other people. Yeah, just every hour, get up, quick stretch. Maybe pull your knee up, or leg stretch, something. Or just do a little loop and then sit back down. Yeah, the way the blood doesn't completely pool and become blood clots, and then that's a whole other issue. Yeah. Okay, well, everything looks good. So, yeah, they'll get you on your way out. Okay, they've got the pamphlets up there for the diet. Okay. Yep. All right, thank you so much. Everything's looking good. Nothing to worry about. Okay, I'll see you next time. Bye. Okay. Hi, how are you? Just give me a second to look over your chart. Got your x-ray back. Looks pretty good. Well, hello. Welcome. Let me get my gloves on. Be comfortable. as comfortable as you can be at a dentist's office, right? Okay. So, open up. Let me just take a quick look. Okay. Alright. So first I'm going to just do a little flossing. Alright. Did you brush your teeth before you came? Yeah. I feel like that'd be kind of weird if people didn't, but you do see it sometimes. Okay, open up. Okay, top. Okay. I'm going to just do a quick brushing of your teeth. I haven't opened this. This is all yours to take home. Very exciting, I'm sure. Anything new in your life? Oh, you can still say a few words. It's been what, 8 months or so? Has it been longer? Oh. I guess I didn't realize it'd been that long. Put this guy on there, and then we'll do a quick brushing. And get this show on the road, okay? Okay, ready. Here we go, open up. It's always a little bit awkward having someone else brush your teeth, isn't it? It looks pretty good though, so far. You know, we'll inspect it a little bit more closely. But, are you flossing? You can just nod. Okay. And with the fingers, can you show me how often a week you're flossing? Alright, good. Upper. Okay. Alright, I'm going to just give you a little bit of water to kind of rinse it down with, okay? So here we go. And swish. And you can spit right in back in. Okay? More? Yeah? Okay. Here we go. Swish. Good. I always make the weirdest faces, you know. I don't know why. It always feels like I have to get my eyes involved. Okay, spit. Okay. Alright. Okay, so let's get these suckers out. They look a lot scarier than they actually are, okay? It just helps us see the back of your teeth, and this is just to, kind of poke around a little bit, okay? Nothing to worry about. You've done this before, so I know it's okay. Okay, open up. Okay. You alright? Mm-hmm. Looks good. Just poking around. Alright, that's the bottom. So it looks pretty good so far. I'll kind of scrape a little bit of the, black off. Normal to have black. We just don't want it to build up and harden, calcify. Okay. I'm gonna get up top. Ready? Okay. And that's always a little bit awkward. You're doing great. Alright. So yeah, we'll just do a quick, I don't want to say scraping, but I already did, cleaning of your teeth. Okay. So I'll just get a little bit more aggressive with some of the black buildup. It doesn't look like you have any cavities, so that's good. There's a little spot I'm going to kind of check out just to make absolute sure, but it looks like it's okay so far. Alright. You alright? I'm going to switch tools here. Alright, ready? Okay, here we go. Kind of stubborn little spot there. It's been a weird year for everybody, I know. I've had a couple people come in and tell me that their at-home hygiene routine has improved quite a bit this year, which I thought was really funny. Just because you can't go many places, so you're stuck at home all the time, so suddenly you're doing all the things that, you're supposed to, but don't have time or prioritize other things, so it's been funny. But it's nice to see things getting a little bit better. I don't want to say better, but I'm glad to see my family, and especially now that it's starting to get nice again. It's nice to go outside and enjoy it. And all the home repairs that I've been seeing everybody do online. It's pretty funny. But you got the time, right? So suddenly people are spending more time on their porch and fixing up their porches, or Till then, alright? I know this isn't always the most enjoyable thing to do on your day off, huh? But it's important. Alright, we're gonna go up. Okay, looks pretty good. I'm gonna have you do another swish and spit here in a second. Okay. Here we go, you ready? Open up. Swish. And you can spit. And this is treated with fluoride, okay? A little more. There you go. Okay. Swish. And spit. Okay. Alright. We're going to do a little bit more cleaning. And then I've got the exfoliant basically for your teeth. The paste has that grit sand feel to it. We'll do that. Okay. And then you're going to be almost there. Almost out already. See? Not too hard, right? Not too stressful. I know everybody always has some anxiety coming to the dentist, but it's not so bad. Okay. We're going to go to the back corner, alright? Back right. Other side. Going for the top, and then we'll exfoliate, and you'll be basically done, okay? Nothing too crazy. I would say that though, wouldn't I? Not getting too stressed, are you? Okay. Ready? Yeah. Open up. Okay. Swish. we're going to do this a couple times because I know that grit is intense. Spit. Okay. And feels okay. One more. Ready? Go. Swish. And I got some minty mouthwash for you too. Okay. Alright, spit. A little better. Okay. Good. So let's brush your teeth again, and we'll do the mouthwash. And if you have any questions, everything looks really good. Your x-rays looked healthy. Nothing impacted or going anywhere. I took out your molars, or your wisdom teeth, excuse me. I'm just looking at it. Fun fact, your bottom middle teeth are called your Christmas teeth because of 24 and 25. They look good. Just have that one filling, but it doesn't look too bad either. I love the new types of fillings we have now. Okay. Get some toothpaste on there. Not too little, not too much. Ready? Is your gums a little sore? They looked really healthy, nice and pink, no signs of gingivitis or anything like that. So you're really, this is just a checkup for you, just a checkup and cleaning, but there's no sign of anything troublesome. Okay. Alright, you ready? Okay. I love when dentists ask me questions when my mouth is full. Everybody's done it. It's just hard not to want to know and have carry on conversations, but a little difficult to respond. Sometimes I find out more about, or they find more about me than I do about them, which is unfortunate because I do want to know what's going on in everybody's lives. But sometimes it's just the way the cookie crumbles. Okay. Up. Ready? Okay. That's a mouthwash. They call this one Whisper Mint. I don't know if you can see that or not there. A Whisper Mint. and I'll oil around. Okay, ready? Here we go. Swish, 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 swish. It's definitely very pungent and mint to smell. Swish, 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 swish. And then spit. Good job. Okay. How are you feeling? Nice and clean? Refreshed? Good. Okay, so take this chart with you. You can take the x-ray as well. Hand it to the secretary and then she'll book you out for the next visit, okay? Everything looks really great. Just keep brushing. Keep doing what you're doing, okay? Thanks for coming to visit. Bye-bye. Okay. Hello. Welcome. Give me a second just to go over your chart real quick, okay? How are you? How did you hear about us? So, we put the Jupe combination skin. Yeah, I see what you mean. It's a little bit. Well, I'll take a closer look in a minute, but yeah, okay. Have you ever had an oil facial before? First time? It's just really relaxing, honestly. It's not like the other ones where you do extractions and you're kind of, a little bit bruised and battered afterwards. This one's very more similar to just a massage. Okay, a massage for your face, basically. So, very relaxing. Any allergies that you know of? Okay. Any questions for me or concerns? Okay. I'm going to set this down here. So I have probably going to use 3, maybe 4. Let me take a closer look at your skin. Different oils on you. And can take, actually, I'm sorry, setting up a little bit here. Alright. Okay, let me get a closer look. Can you touch your head a little bit? Yeah, I see what you mean. You got kind of the oily forehead, but then your cheeks kind of dry out, almost a little rosacea. What kind of products do you normally use at home? Like your just cleanser. I'll start with that. Tea tree cleanser, okay. It's really good. Tea tree has a natural antiseptic qualities for you and antifungal, so it's it's very gentle on your skin as well. It's excellent. Okay. What about your makeup? Are you washing those brushes? How often? Okay, I'd probably step it up a little bit more because, when you're putting your makeup on, you're using those brushes, the bacteria just goes right into them, and if you're not washing them, you're just putting bacteria back on your face. So it's definitely a good idea to try your best to wash them pretty regularly, okay? That will help. Okay, so I think I want to start one with this. So I've got a couple different ones. We're just going to start with some vitamin E oil, very moisturizing, and we'll start from there, and then I'll get a hot towel afterwards that kind of open you up for the rest of it, okay? Just want to rub this in. A few drops, you don't really need a whole lot. Nice down the cheek, under your eyes, other eye. Okay, just rub it all in. You get a very nice skin. And I think you'll find this to be a very lovely effect on your skin. It's going to make you look so glowing and healthy and vibrant. Okay. So let me get a hot towel. We'll put it over your face for a minute and then we'll continue, okay? I'll be right back. Put it on your face a little bit. Sorry, it's kind of in your eyes, isn't it? A little bit. Trying to get it so it's not so bad. Okay. Is that alright? Okay. Not too hot, not too cold. Excellent. So I like your cleanser that you're using. That's a good one. And just let that sit for a second. I'm going to review some things on your chart. It says here that you're also maybe interested in an extracting facial, which is, very different. Of course, we do that here. It's just going to be a little bit more intense, okay? You're going to look a little flushed afterwards. Have you ever had one of those before? Okay. Feels so nice and warm, though sometimes you don't want to take it off. I know how that is. My grandma used to wake me up with a hot washcloth, and it was always one of the best ways to wake up, I felt. So we're kind of spot. Okay. Nice and opened up. Alright. So I'm going to use rose hip oil on you. Very moisturizing. And you can use this for a couple different applications, your hair, your skin, your nails. I find it to be very good. And it's got a little bit of a yellow tint to it. I also put rose hip powder in my morning smoothies sometimes. It's very good for your body. Okay. It's just a nice feeling, isn't it? Kind of healing, calming. Down a little bit. Chin. Other side. The only problem with waking me up that way is when you get kind of hooked, but too. It's warm and it feels comforting when it's on, but when she took it off, your skin's that much more cold. So it's hard to be thrilled about that part when she took it off. But it was effective. Nice warm feeling, and then all of a sudden you're cold. Kind of wakes you up. So you can try that sometime. Try that on somebody else maybe. Maybe just one more little dot. Can I really rub it? I Gonna give that just about a minute to settle in there. And I'll just kind of get to know you a little bit better. Any siblings? I have one older sister who we were very, very close growing up. She's about 2 years older than I am, 2.5. And like we were very close. Hardly ever argued unless it was the morning, because I was kind of a bit of a brat in the morning, to be honest. And just it's hard for me to wake up. And she's the opposite. She bounces out of bed and is so excited for the day. It is really hard to deal with that kind of in your face energy right when you wake up for me. So that was pretty much the only time of day that we would fight. Just in the mornings. For the most part, having your siblings do occasionally fight, but we got along really well. Okay, I'm gonna put this jojoba oil on it. I always pronounce it wrong, but this one's also really good for your hair and your skin and your nails. They put it in a lot of different like hair oils now. So I've been noticing it's definitely starting to trend up a little bit on that level. So, my sister and I were pretty close growing up, and then I kind of got these bonus sisters because, she has friends, and then they come over her, and then they end up being, adapted to kind of her friends being over, and you get these bonus sisters. So I have a few of those. My dad, I guess, I don't have actually a memory of this happening, but it's a story he told me later about, I guess one time we were really fighting, and he got frustrated and brought us inside because we were playing outside in the backyard, and he sat us down, and he got real stern with us, and he was like, you guys are sisters, you're siblings, you love each other, that's it, we don't fight. And we really didn't. We learned that was the expectation, and it was not going to be, looked upon positively. And there's one thing that my sister and I, we definitely are people pleasers. We try to, make everybody feel good, and we didn't want to upset them. So that was it for the most part. We didn't really fight too much. Okay, that was settle a little bit. Put the lid back on this guy. I also had a few of my parents, friends, and colleagues that we all had every Friday that we spent together. So I had, my sister and my sister's friends, And then this other group that we hung out with, and there's 2 more kids in that group too, so there's a little foursome of that group. So, and there was one of the younger ones. So I always felt like I had a lot of guidance, I guess, growing up. My grandparents, my parents, my sister and her friends, and then this other group too. So I had a lot of people telling me things sometimes that I didn't want to hear, but it's okay. So this one's vitamin C serum, 30%. It helps with, kind of repairing your skin, moisturizing. I like the other 2, big on moisturizing today. And yeah, it's just really good for any blemishes or fine lines and wrinkles and those kinds of things. So we'll pop this on there. I'm almost out. I'm going to need to get some more soon. And I do use a retinol and hyaluronic acid serum as well, but for today we're just doing the oil massage. So I think another time we can have you come back and get something a little different, maybe the extracting or the acne prone skin facial. We have quite a few. So I'll hand you a brochure when you leave, okay? When you check out, you can take a look at all the different ones we have and decide whether or not you want to try the others. So, a little bit thicker. Try to warm it up a little bit. Hopefully it's not too bad. And of course, as always, anytime we come in here, I'm going to remind you to, hydrate. Hydrate. Drink plenty of fluids, not soda, water. Nothing sugary because it does affect your skin. And then of course sunscreen when you go out, okay? Especially now it's starting to get nicer out. So, and even those cloud covers, I made the same mistake. I got burnt pretty badly this year already because it was overcast, and I was thinking, well, it's not too bad. I'm not going to be out here for that long. But I do put on a daily sunscreen moisturizer on my face. So my face actually was pretty okay. It was my shoulders that really got the brunt of it. But I feel like I learn this lesson every year. The first few times I go out and then I am good. But I don't know why I can't figure it out more than that, especially since I preach it, But I did do an okay job on my face because it was covered. Look up for me real quick and I'll get right. Okay, and then close your eyes. But I shouldn't be complaining about the sun, at least we're getting it again. It was quite rainy actually a couple days ago here. And I was glad because then I didn't have to water my plants. But I stayed inside, curled up with a little book. Okay, that looks pretty good. Give it another minute. Let it soak into your skin a little bit. Actually, I'm going to just take these clothes off because I think we're done. Do you have any questions or concerns or anything for me? No? So you are more than welcome to hang out in this room for a little bit. You got the candles and I'll dim the lights maybe a little bit. And you can hang out here, okay? When you're ready, come on out. I'm going to take your chart to the front desk. And we'll put you in our system again. And we'll kind of arrange for if you have any questions for other facials or want to make an appointment. You can do that then, alright? But yeah, take your time. Okay? I hope you're feeling very relaxed and refreshed. And there's a mirror on that wall, obviously you can check it out when I leave, okay? Okay. Thank you for coming in. We'll see you next time.